Well, good morning, good afternoon, or good evening, everyone, whichever the case may be, wherever you are. And welcome to Retain Kentucky's Lunch and Learn webinar series on return to work and stay at work for people with disabilities. I'm Phil Rummerl. I'm a professor of counselor education and director of research in the Human Development Institute at the University of Kentucky. I am phoning in today, but I will give a brief visual description of myself as a universal design matter, and I'll ask my colleagues on the panel today to do the same. I'm a 56-year-old white male. I am mostly bald with a little bit of gray hair. I have hazel colored eyes. My pronouns are he, his, and him. I'm wearing a white shirt with a collar today, sitting in a nondescript office setting with a background that is not remarkable in terms of contrast. I am a member of the disability community. I happen to be blind. I use person-first language to describe my experience with disability, but we certainly understand that many folks prefer to use identity-first language, and we certainly honor and respect everyone's prerogative to express themselves in any way they wish and identify themselves how they would like to. We are glad to be with you today. The title of this first presentation in our series is, Does the American Dream Apply to the Disability Community? I'm still, I believe, on the title slide. I want to begin by thanking our online learning manager, Mr. Brandon Canada, who is not on the screen today. He's a behind the scenes guy, and we invited him to join. He wanted to stay behind the scenes and taking care of all the technical aspects of the program today, including recording this program. So Brandon, thank you as always for your outstanding expertise and everything you do to make all of these things we do go. We're glad to have you with us. I'm also joined by Deborah Minton, who is a return to work coordinator in the Retain Kentucky project that we'll talk about here in just a moment, and Pam Rumberg, who is a graduate student at the University of Kentucky in the School of Social Work and an intern working with us in our Human Development Institute at UK. Pam, I believe you're on video and you're going to be monitoring the chat. Would you be so kind as to provide a visual description for anyone who might prefer that?
Sure, I'd love to, Phil. My name is Pam Rumberg, as Phil introduced me. I am a woman who identifies as a she, her. I have black, long curly hair, green hazel eyes, and I wear glasses. I am wearing a black sweater with some hot pink and green stripes on it. And I am happy to be here and part of this webinar.
Thank you, Pam, and you'll be monitoring the chat today, so thanks for that. And thanks also, Pam, for all of the developmental work on this, preparing the flyers and the announcements. Many of you who've joined saw Pam's name on the email correspondence, and I'm told we have more than 70 folks with us today, so we're Pam at work, so appreciate that. And Deb Minton?
Yes, hello, my name is Deb Minton. I work at the University of Kentucky in the Human Development Institute on the Retain grant. I am a middle-aged white woman with dark blonde hair, and I am currently wearing a cranberry shirt and black sweater, and I use pronouns she, her, and I am excited to be here today.
Thank you. And Deb, you will be advancing the slides, so if I get ahead of myself, go ahead and advance. Feel free to stop me if I'm on the wrong one, any of those kinds of things. Folks, with me phoning in like this, sometimes it's a little difficult to stay on the particular slide, but I think with my three colleagues here we will manage just fine, not because of me, but because of them. We will have a chat that is available if you'd like to post a question or comment in the chat. I will stop periodically and invite Pam to read selected items from the chat. Any items from the chat that we don't get to that require a response, if you'd like to follow up with an email, my email is provided at the end of the presentation here, and these slides are available to you. I'd be happy to correspond with you as well. If the chat doesn't work for you for any reason, Mr. Canada will be monitoring the video screens. If you hold your hand up or press unmute, we will recognize you at that time. If you'd like to interject a question, with 70 plus folks on the call, we didn't want to leave a total open mic situation. Sometimes the background noise becomes a bit prohibitive when that happens. So we'll try it this way. If the chat or holding your hand up or unmuting should cover it if you have a question or comment. We invite you to interject those at any time today during the program. We have until 1 o'clock today, and we want to say that this, if you go to the next slide, please, Deb, this is just an acknowledgement and disclaimer. I want to let you know that this presentation is being sponsored by our Retain Kentucky grant. This is a large 4-year grant funded by the United States Department of Labor. You see the details on it there on the screen. This is a statewide workforce development project, one of whose purposes is to share content and lessons learned from our statewide workforce development program with students and other people working at colleges and universities who share in the endeavor of wanting to make sure that the American labor force is fully inclusive of and accessible to members of the disability community. That's why we start with today's presentation in this way. The federal government does want me to say that the remarks here today that I will make are my own and do not necessarily reflect the policy or practice of the federal government. So I guess I'm a free agent as far as that is concerned today. So we'll go to the next slide, please, Deb. This is just in the way of prefatory information. Folks thought we'd get started with a few, shortest part of any presentation I ever do is when I tell you what I already know. And so here are some things about what's happening on the American disability scene. I'll just click these off fairly quickly and we'll get into the heart of the matter. We know there's about 67 million people with disabilities in the United States, and these are people who meet the Americans with Disabilities Act's definition of a disability. This does not necessarily include people who have long COVID, and we'll get to that in just a moment. So the disability community over the past almost 5 years has grown considerably, and we'll talk about that in just a moment. But this is not including folks with long COVID. We haven't quite known how to integrate that into our overall census. We also know that as many as 80% of about 20% of all Americans are living with a disability currently, but 80% of all Americans will experience a disability at some point in their lives. And this is due, of course, to advances in medicine, increased life expectancies. So people with and without disabilities are living longer, often more comfortable lives than ever before. There's a strong relationship between age and disability. The older you get, the more likely you are to have a physical or mental impairment that substantially limits your functioning. I told you I wasn't going to give the ADA's definition, but I sort of just did. So as the population of America continues to age, and we see a straight linear relationship between age beyond age 30 and health considerations and also the rate of disability, that's where the 80% figure comes. If you live long enough, you will acquire a disability at some point in your life. At the same time, we know that more children than ever before are born with disabilities. This is mostly because they are surviving complicated pregnancies and births that they may not have previously survived. So this is a good thing. This is an advance in terms of medicine. We're able to sustain life over a period of time. Many of these children who formerly would not have survived birth are now doing so, and many of them are then dealing with significant disabilities throughout the course of their life cycle. So what this means then is that the disability community, if this is even possible, is becoming both younger and older. So we see proportionally more younger people who have disabilities, proportionally more older people, and therefore has to be proportionally fewer people in the middle age range. With all of this, we know that disability is increasingly being viewed as a naturally occurring and therefore normal part of the human experience. It's a part of human difference, of individual difference and human variation. And we're seeing this concept hold true in all kinds of, in the disability pride movement, in the current conception of disability and the role that it plays in people's lives. And those of us who work in the inclusion fields view this as a very positive thing for the disability community as well as for our society as a whole. Deb, if we go on to the next slide, again, another what's new. We know that the COVID-19 pandemic has had a disproportionate impact on the disability community. People with pre-existing health conditions were more likely to acquire COVID, more likely to have a negative outcome of COVID, including the ultimate negative outcome, which is death. Also know that people with pre-existing health conditions are more likely to acquire long COVID than people who didn't have prior health consequences. So disability and COVID really inextricably linked, and we can't remove discussion of disability from what's happened with this unprecedented global pandemic. Next slide, the Workforce Innovation and Opportunity Act, focusing on competitive integrated employment, and that means employment that and this focuses on services for people with disabilities to ensure they're in competitive integrated employment. Competitive means they're making at least the federal or state minimum wage, and integrated means that they're working alongside people with and without disabilities in a community setting. We also have a strong focus, again, because of the proliferation of disability population in the younger age range. We have a strong focus on services for children and transition age youth moving into employment. We could talk about technology. That should be its own webinar, and in fact will be in our series here, just thinking about the impact that continues to have on health and function. And in our conversation here today, return to work, stay at work services, employment in terms of workplace accommodations, and universal design. So just an explosion of technology with really encouraging and exciting things happening that really portend very well for people with disabilities who are seeking to participate fully in their communities and achieve all the same benefits and privileges of life in our great society. So with all of this, the disability community has really changed dramatically over the past 40 years in terms of its constituents, who people with disabilities are, the types of disabilities and health concerns that they're dealing with, the contributions that they can make to the national economy, and their needs for healthcare and rehabilitation services, and where their concerns are placed on the social policy agenda. A colleague of mine, if you go to the next slide, Deb, Dr. Lynn Cook from the University of Arkansas. The next slide, just a screenshot of a book that Dr. Cook and I wrote in 2017 on rehabilitation counseling and emerging disabilities. We were so taken by the changing population of Americans with disabilities and the disability community that we wanted to look at those changes, and we came across this concept of emerging disabilities. Deb will go to the next slide. And we didn't coin that term, but we've been using it ever since. And we define emerging disabilities as conditions that are either new to medical science or are increasing in incidence or prevalence within at least one segment of a given population. We know that people with these emerging disabilities, because they're either new or growing in terms of their impact and import, these conditions are often misunderstood by medical professionals, by service providers of all kinds, and even by people with these disabilities themselves. People with emerging disabilities are more likely than people with what we would call traditional disabilities, ones that don't meet that definition. They're more likely to live in poverty. They're more likely to identify as female or women. They're more likely to be members of racial or ethnic minority groups. They're more likely to be younger. They're more likely to be older. Here again, we see this bimodal age distribution in the disability community. And they're more likely to be dealing with multiple and or invisible symptoms, effects of their disabilities that are not readily apparent to others. And this certainly informs how other people react to people who have conditions that are invisible and not readily apparent, how disclosure works, and things of that nature. So with all of this, it shouldn't be any surprise that people with emerging disabilities, they often experience invalidation of their conditions by significant others, including family members, by professionals as well, experience skepticism about the very legitimacy of their needs because those needs are so poorly understood, stigmatization, of course, and the ultimate manifestation of negative attitude is behavioral discrimination. We know that people with emerging disabilities are denied rehabilitation and healthcare services, they're denied legal protections, and they're denied disability benefits at higher rates than people without disabilities. Just setting the stage for the population of Americans with disabilities to inform this discussion today and also subsequent ones that we'll have as part of this series. Next slide gives us some examples of emerging disabilities that meet this definition. Before I do though, Pam, I want to pause and see if there's anything in the chat that we should address now before I proceed.
Phil, there's nothing in the chat right now to discuss.
Okay, Brandon, any hands or anyone unmuting wanting to make a comment or ask a question?
It looks like we are all good right now.
Okay, great. Deb will go to the next slide, examples. I won't belabor these, folks, and if you want to email me, I could give you more information on many of these conditions, but I'll just click some of these off. Autism spectrum disorder and other neurodevelopmental disabilities really see a profusion of autism diagnoses. 1 in 25 males born today will be diagnosed with autism during childhood. About 1 in 45 of all children born. The year I was born, 1968, that figure was 1 out of 6,800. So we've got a really exponential increase in diagnoses of autism. Really interesting things happening in the self-advocacy movement with autistic individuals. Would encourage you to read up on all the things that are happening with a great and growing awareness of what autism is. If you're dealing with disability issues, for sure we see a high comorbidity with addiction, substance use disorders, drugs of choice change over time. You all know about the opioid analgesic epidemic that we have in certain parts of the country. Methamphetamine use continues to really skyrocket. Increased use of marijuana in most segments of the population, decreased use of cocaine, for example. Alcoholism rates tend to be about the same, but whenever you're looking at issues of addiction, it's important to see what the substances are that people are addicted to and what the treatment modalities may be. Another category of emerging disabilities are those related to the environment. We just don't know what kind of workout our immune system gets because of the environment, but we do know that many more people than previously are being diagnosed with asthma, with allergies, with multiple chemical sensitivity. Enough said about that. If you go to the middle column on the slide, Rare Disorders, the National Organization for Rare Disorders outside of Washington, D.C., represents people who have any one of the more than 5,000 conditions that are known to medical science that affect fewer than 5,000 Americans. So we are understanding more and more about these rare disorders. There are more of them, and people are, as awareness increases, people are being diagnosed with these conditions, getting the treatment they need. So it is perhaps a contradiction in terms to say that rare disorders are becoming less rare, but that really is, in point of fact, that's true. Would commend you to the National Organization for Rare Disorders to look at their website and just see the conditions that they the conditions that they represent, and perhaps you know someone who has a condition that is not well known or not doesn't have a very high prevalence rate, and you could learn more about this and the advocacy that they're developing by sharing resources across people who have these rare disorders is very, very powerful. You see a number of lifestyle related conditions. Diabetes is sometimes, not always, related to lifestyle. We have 38 million Americans who have diabetes, 11% of our populace. So if you just do disability work or advocacy in 2024, you have to understand diabetes, heart disease increasing in most segments of the population, especially growing among women. Stroke, the number of strokes each year stays relatively stable, but survival rates have increased. This is a good thing, and that means that we have more people, more stroke survivors in our population. COPD and other respiratory conditions. Certainly COVID didn't help this phenomenon, and long COVID has as well. Certain forms of cancer growing. Next bullet there, you see a mention of chronic pain. We estimate that as many as 100 million Americans experience pain on an ongoing basis. There's a pain epidemic in our country, and it also relates to, for example, the opioid analgesic crisis and things of that nature. We see increases in post-traumatic stress disorder and other stress and trauma-related disorders. Enough said about the stress and trauma that appears to be endemic to life in our society right now. We see this increase in disabilities caused by violence of all kinds, including random violence, domestic and intimate partner violence, child abuse, military combat, large numbers of conditions being caused by violence, most and including traumatic brain injury. We all know the increased incidence of TBI in our society among military veterans, among young people engaged in contact sports, for example, and the ongoing effects of repeated injuries to the head, concussion, and CTE-related complexes and things of that nature. So traumatic brain injury, a growing issue. Autoimmune diseases of various kinds, multiple sclerosis, the incidence of MS, the prevalence of MS has doubled in our society over the past 10 years. Lupus, Graves' disease, Crohn's disease, many others. Again, immune system sort of turning on itself and then not functioning in the way that it ought to. And we're seeing growing numbers of folks with these kinds of conditions. Here we go again with the age-related health conditions. Dementia, the number of people with dementia is going to double between 2010 and 2030. Hearing loss, low vision, 65% of all people in the United States who are legally blind are over the age of 65. Orthopedic impairments, Parkinson's disease, various kinds of arthritis. Next slide, please, Deb. And maybe the ultimate emerging disability, let's talk about COVID-19. This slide, COVID-19, long COVID, and disability. So according to the Centers for Disease Control and Prevention, or CDC, long COVID may affect as many as 23 million Americans. And so this is the situation when people who have acquired COVID-19, and then after they're no longer testing positive, they still experience lingering symptoms. We estimate that as many as half of all people who experience COVID-19 have lingering symptoms that go beyond the point of the acute stage of the illness. So the symptoms can kind of come and go, and the same symptoms of COVID often remain in long COVID. It doesn't necessarily have anything to do with how severe your acute case was. We expect that long COVID may be responsible for as many as 1 million people exiting the American workforce. The chronic and unpredictable condition that we don't know whether it ends up being progressive over time in all cases. In some cases, the effects seem to fade, but 90 days after acquiring COVID-19, somewhere around half of all Americans are still experiencing some sort of lingering symptoms. And those, as I mentioned before, those with mild acute symptoms may still be susceptible to long COVID. So it really is a separate matter and a separate condition. And we'll go to the next slide, please. There's a rhetorical question: is long COVID a disability? If we're thinking about it as an emerging disability, what does it say under the law? And what we can say is that in 2022, the United States Department of Justice and the Equal Employment Opportunity Commission designated long COVID as a presumptive disability for protection under the Americans with Disabilities Act. This is our greatest of all civil rights laws for people with disabilities in the history of the world. And if you have long COVID, you now cannot be discriminated against on that basis, according to the civil rights law for people with disabilities, that is the ADA. So we know that people with long COVID, even though they may not identify as such, are certainly members of the disability community. And the federal government is ensuring that they have access to fair treatment in the workplace and in pursuit of other community activities in a range, whether that's government services, government funded services, privately held public accommodations, communication systems, you name it, just as people with other disabilities have the right not to be discriminated against and the right to equal access, so too to people with long COVID. We know also that people with long COVID are eligible for state vocational rehabilitation services throughout the nation. They're eligible for federal disability benefits on the basis of their long COVID. And this is important, especially because long COVID very frequently co-occurs with other health conditions. So long COVID can be disabling in and of itself. It can create disabilities that people didn't have prior, but it can also exacerbate the effects of an existing health condition. So long COVID can, like we think about as far as disability goes, it can co-occur with other symptoms people might be having, or we can consider it on its own. In either case, when we put it together, it's having at least an additive and sometimes cumulative effect on people's functional capabilities and their abilities to work and engage in other meaningful social activities. So with all of this, this is really the population of people with disabilities that we are looking at here. And as we think about return to work and stay at work services for this always changing and growing disability community, we've got to take the inclusion imperative. If we want people with disabilities to participate more actively in the workforce, we've got to look at what that labor force is really all about. So let's take a look at the current American labor market. That's the next slide. Before I do, Pam, any questions in the chat?
Nope, Phil, there's no questions at this time.
Okay, Brandon?
You are all clear to proceed.
Okay, great. So here's a few things we know as of right now, and we just can't remove the pandemic from discussions of our current economy. We know that 50 million people have had their employment interrupted for at least part of the time, or for at least a short time, since March of 2020. And we estimate that as many as 10 million of these individuals have not yet returned to work. We don't know exactly what that figure is, but many people disengage from the workforce, for an extended period of time. At the same time, 20 million new jobs have been created since the beginning of the pandemic. And the industries and areas and how the way work is done has changed. Telecommuting, work at home, the proliferation of technology, and during the acute phases of COVID, remember all the transportation jobs and things like that. But certain industries also were shut down. And it continues to change and evolve as we come out of the COVID-19 pandemic, at least economically. But the pandemic is still really alive and well, isn't it? Because we're still contending with acute cases. This is going to be an ongoing and hopefully manageable public health situation, but it's not going away anytime soon. We also have record low unemployment, right around 4% in our general economy. With all of this, we have a lower rate of labor force participation among our entire workforce than we did in February of 2020. About 62% of all working age adults in America are employed for pay. So this means this full employment economy with low unemployment and low levels of labor force participation at the same time, and with large numbers of jobs available. This means that employers need workers in ways that they never have before. This is really an unprecedented labor shortage that we have before us. And this really portends positively for opportunities for workers with disabilities. And we'll get to that in the rest of our time together here today. We know that nationwide there are 2 job openings for every job applicant. So if you're looking for a job right now, you're likely to have a choice about what kinds of opportunities might be available to you and what kinds of things you might want to consider. Now is a good time to consider. We know that as many as 30% of all Americans who are working tell us that that they're thinking about changing jobs. So this is a time of some transience in our economy, the gig economy, people stringing together 2, 3, 4 part-time jobs, self-employment, entrepreneurial ventures, things of that nature. So a lot of opportunities await members of the disability community. And I say await because we're not quite there yet. This last slide is really the problem. We look at the employment to population ratio, and this is the percentage of people in a given population, in this case, working age adults with disabilities. How many of them are employed for pay right now in 2024? Well, that figure is 40.6% of people with significant disabilities are employed, and it's 77% for non-disabled people. This is not good enough, folks. We need to do better. People with disabilities are twice as likely to be disengaged and disenfranchised from this unprecedentedly prosperous American economy. And so if we're going to continue to move toward this imperative of a fully inclusive workforce, we have to, employers are saying they need every available worker, every hand on deck. And we've got a group of people who have a lot to contribute to the economy, but currently are really unemployed and underemployed at really troubling proportions. And what are some of the reasons for that? The next slide here, wishing all these old things were new. This has been happening for a long time. Here are some of the reasons for this disparity in employment that we continue to see, and this has been durable since World War II, this 2-to-1 disparity in employment rate. We hear about fundamental negative bias, that people generally, especially non-disabled people, view the disability experience in a negative way. And the ultimate way they express that in the workplace is through workplace discrimination. We know that about half of all workers with disabilities feel they've been discriminated against at some point in their careers. We see here that inclusion of people with disabilities has been brought forward into diversity, equity, and inclusion, and now accessibility initiatives in industry and in government and at colleges and universities. But this has become a really controversial concept. I won't go into this too deeply here, but I have the term here, the assault on diversity, equity, and inclusion. And let's just say that not everyone agrees that we ought to be taking steps to build the most diverse, equitable, and inclusive workforce. And we'll leave it at that. Disincentives in supplemental security income and Social Security disability insurance, Social Security benefits, for example. You get these benefits if you have been adjudicated as being too disabled to work. You have to have taken yourself out of the workforce to receive disability benefits. That's why you get them. And what happens is when people get on those benefits, they begin to internalize that message that they're not capable of working. And so they disengage from the workforce. And once someone gets on disability benefits, it's very difficult to help them get into the workforce, because as soon as they start working, they stand to lose those benefits that sometimes they had to work very hard to prove they were eligible for in the first place. So the issue of disincentives becomes an issue. Low expectations on the part of parents, on the part of people with disabilities themselves, on the part of our government. If we're sanctioning people for staying out of the workforce and considering a group of people and considering them too disabled to work, how do we go about disabusing society the idea that people with disabilities cannot work? We see gaps in opportunity related to all of this. Of course, transportation becomes a major issue for many people with disabilities, and that's been overcome somewhat by being able to work at home, telecommuting, things like that. We see low rates of home ownership among people with disabilities, a tendency for people with disabilities to live in congregate and institutional settings, including correctional facilities, to a much greater extent than people without disabilities. We see disparities in education between people with and without disabilities. Of course, health and mental health outcomes need to do a better job here as well. So if we look at leveling the playing field all the way around, and we see active engagement in the workforce and competitive integrated employment, helping people get in the workforce as soon as they can, doing jobs that are meaningful to them, or staying in the workforce as long as they wish to do so, goes a long way toward ameliorating many of these sorts of disparities. We have the state vocational rehabilitation program that's available in every state in the union. During COVID, people were generally underutilizing state VR services. We want to see more people receiving these services. That can be very, very helpful. The commonly asserted technology divide with the connection between disability and poverty, and also assistive technology, sometimes being 1 year, 2 year behind general use technology. So people with disabilities needing technology that would help to level the playing field, and then not having access to the technology or to the training that they might need. And even though employers understand and recognize the need to hire people with disabilities and with other diverse characteristics, we see that employer myths and misconceptions and negative attitudes about hiring people with disabilities still persist. So in the remainder of our time today, and in our next 6 programs that we're going to do, we want to talk about strategies that we can do to help move the needle on these reasons for the low rate of labor force participation among people with disabilities. And we're seeing some improvements happening in pockets. We know how to do this at the individual level. We need to do it more at the systemic level. And we see that opportunities really do abound for what we call total workplace inclusion. And if we go to the next slide, we'll take a look at that. But before we do, Pam, any questions in the chat?
No, Phil, there are no questions.
Okay, Brandon, anything?
You are still all clear, Phil.
Okay, very good, good. And I am keeping track of the time. So here's some steps we think, and we'll talk about each of these in more depth, over our subsequent seminars. And Pam, you're going to put in the chat our next one on November 19th. This one will drill down a little bit on the phenomenon of workplace discrimination against people with disabilities, and we'll be sending link information for that one, and would love to have you join us for that. But as we seek to make sure that every person with a disability who wants to work is encouraged to do so, even expected to do so, and has the opportunity to do so, we've got to look at what these, we call them, this next bullet, we call them hot industries and occupations. Where the jobs are, where is the growth happening? Of course, the technology sector, green energy jobs, for example, jobs in the arts, essential workers, for example, transportation. These are some of the areas and industries, and it varies from state to state. And then types of occupations, working from home, telecommuting, using technology, where in ways that these jobs didn't require previously. Information processing, the whole AI proliferation that we're seeing, and we're going to need people who are conversant with all of these technologies and how that's going to work. We're going to need new and renewable power sources, right? And electricity, you see this all over the news, where some of the technology companies are developing their own power plants to account for the growing need for energy, and particularly clean energy. Commend your attention to the ONET labor market analysis system. Just visit the website. It's a self-guided process. You can look to see what jobs are most abundant in certain areas in your communities, how much they pay, who's hiring, what the outlook is for those positions, all kinds of things that can be done if you're looking for work in a general locality, or you're looking to see what the call is for cabinet makers in Boise, Idaho. You can find this out, and it's very important to have up-to-date and accurate labor market information if we're going to be hoping to make sure that we're making better matches between workers' skills, interests, and abilities and available jobs. The State Vocational Rehabilitation Program, available in every state, ready to assist. It's a free service. It's not means tested. People with disabilities can use this, and we spend about $4.2 billion a year on vocational rehabilitation services. Over half of everyone who participates in the VR program exits the program in competitive integrated employment. So this is a really important service we want more people to take advantage of. The Inclusive Higher Education Initiative, more people with disabilities are going on to college and taking post-secondary training than ever before. The number of college students with disabilities has quadrupled in America since 1980. We see this as a tremendous boon to the career opportunities that await workers with disabilities. We talked about the myths and misconceptions of employers about hiring people with disabilities, but we see that employers requiring workers so much that this national labor shortage, employers we find are more accommodating than ever before. They're more willing to have the conversation about strategies that will help retain productive and capable workers. Employers know that overall that an inclusive workforce is good for business. Customers like to patronize establishments where the employer is proactive and provides opportunity to a wide range of people. We know that accommodations in the workforce, this used to be a concern for employers about the cost of accommodations. We know that accommodations are generally inexpensive, and when they do have a cost, they're very cost effective. Our friends at the Job Accommodation Network at West Virginia University tell us that 57% of all accommodations used by workers with disabilities in America cost no cost whatsoever. And of the 43% that do bear a cost, the average price, $500. Any of you who are in hiring authority in any business, would you pay $500 to keep a good, qualified, capable worker employed indefinitely? Comparing that to the cost of turnover, of course you would. And employers are starting to see that. The cost of accommodation, the process of accommodation, not dissuading employers in the way that it has at other points along the way. We see all of these talent pipeline programs, transition programs of services. We love the apprenticeship programs where people can learn by doing while they're getting paid and develop very specific skills, usually in highly paid jobs as well. What else do we know about the disability community? Most people with disabilities say they want to work, they feel they are able to work, and they say they are ready and prepared to work. Seem to have the same desire for employment as people without disabilities. So we have a valuable labor resource that exists within the disability community. And we're seeing in pockets all kinds of approaches when employers and healthcare providers in our Retain Kentucky program, for example, where when everyone who has a vested interest in making sure that our workplace is totally inclusive, when people come together and communicate about that, good things happen and larger numbers of people with disabilities go to work and stay at work. This last bullet, equal to the task, what do we mean by that? Studies for years and years, decades and decades, have demonstrated over and over that when given an opportunity and when accommodated in ways that meet their needs, workers with disabilities have the same records of performance, productivity, safety, same rates of attendance on the job. Workers with disabilities are just as good as workers without disabilities. No evidence to suggest that as a group they're any better, but there's no evidence to suggest either that they are any worse. They literally are equal to the task, and any measure of success in employment, when people have the opportunity, we see that disability really doesn't bear on people's ability to be a good worker. And the word is getting out on this, and we're continuing in this direction. In the next few seminars that we'll have here in these webinars, we're going to get into the nuts and bolts of how this all happens. But if you go to the next slide, we want to close by asking you and inviting you to join us in what we call the Total Workplace Inclusion Movement. We didn't start this. This is something that the disability community has been involved in for a long time. We are pleased to be a part of it through our Retain Kentucky program. But join us in making sure that the American workplace is totally and fully inclusive and accessible to people with disabilities. We've decided that we will rest and we'll congratulate ourselves for a job well done when every American with a disability who wants to work, number one, is expected and encouraged to do so. When every American worker with a disability has the same opportunity to work as do non-disabled workers. When every person with a disability who wants to work can do so in a work setting that includes people with and without disability. That's the integrated part, right, of competitive integrated employment. When every person with a disability who wants to work does so in a setting that is universally designed and fully accommodating. And we've got some great models of how this happens. There's going to be a program later in this series about this very issue of universal design and accommodation. Some really interesting things happening there. We'll rest when every person with a disability who wants to work receives the same pay and benefits as non-disabled workers. And we will finally rest and congratulate ourselves once again on a job well done when every person with a disability who wants to work and when everyone in the disability community enjoys all the benefits and privileges of membership in our greatest of all societies. So we're not asking for much, folks. Actually, we're asking for quite a bit, aren't we? But you have to aim high. We find there's so many really terrific things happening and encouraging things going on. We're beginning to move the needle, and we need your help to continue doing that. So please join us for our next programs. The next slide is That's All, folks. This is really meant to be kind of our teaser, and the next program will be on November 19th. but we do have a few minutes left. Pam, I'd be happy to take a look in the chat now if there's anything at all. And we can also entertain any questions, Brandon, if anybody wants to unmute and ask any or make any comments whatsoever.
Well, we do have one question. So the question is, despite my physical disability, I've been working for several years. Currently, my health insurance will be canceled in 2027 as a result of being employed. Are there any suggestions to keep my insurance while working?
Well, yes, and we would, first of all, you see my email at the end of the slides here. Would be happy to talk with this person off air if you want to email me. What we do know is if you work 30 hours a week or more, your employer has to offer group health insurance benefits to you regardless of disability. So if this question has to do with the continuation of Medicare or Medicaid benefits, or some ways that you can actually continue those benefits even while you're working. So the best way to make sure you're maintaining health insurance coverage is we want to work with you so that you're getting enough hours in where you can obtain and continue healthcare benefits from your employer. Because once you're on those benefits with your employer, you can't be denied coverage. They can't take the benefits away. There's no lifetime or annual cost caps, etc. If it's a matter of continuing your government disability benefits while working, we want to make sure that you're taking advantage of all of the incentives that exist that encourage people to work and maintain benefits while they're still receiving benefits. So there's sometimes you can continue receiving your benefits, continue working. It depends on how many hours a week you're working. Sometimes it depends on what your income is, depending on which benefits you are receiving. But the short answer is, let's find a way to help you get to the number of hours you want to get to so you'll be covered by your employer's insurance program. And if that's not a feasible option, then we're going to look more closely at the benefits that you do have and what those provisions are, and find a way for you to be working the exact number of hours that work for you while still maintaining your benefits. We've got to have those things go hand in hand. And the person who asked that question, email me if you'd like to talk further. I'd be glad to do that.
That is the only question that came through, Phil.
Okay, Brandon, anything else? We can leave the floor open for a few more minutes.
Anyone?
Hello? Yes, hi. I'm the person who, my name is Emma. I'm the person who asked that question. So
Yes.
I currently live in California, and in California we have, I apologize for the background noise in at work. Well, we have for insurance, we have Medicare. And so I've been working several years now in the social services industry. And so currently I work for 80 hours a month, and then 40 hours a week. And so I've been doing well. And although my employer does offer insurance, the insurance, because of my disability, is not something that I can benefit from, because UCLA only takes a specific type, which is the Medicare Medi-Cal insurance. And then, as I mentioned in my text, my chat, recently I received a letter from the Social Security Administration informing me that in 2017, I will no longer be covered through Medi-Cal because of my employment. Which, and in a nutshell, I don't want to stop working because I don't have a reason to stop working. I enjoy what I do. I'm able to work. Despite my disability, I want to continue to contribute to society. And I don't want the ability to be an impediment to stop working, much less being cut out of my insurance and forced to stop working. So that's why I appreciate your help in this to my question.
Yes, there may be some provision, and Medi-Cal is actually, that is California's Medicaid program, right?
That is correct. Yes.
Yes. There are provisions where even after you exhaust your eligibility for Medicaid, sometimes you can continue those benefits. For example, sometimes people can pay the premiums, which are actually quite reasonable, and continue having that benefit even as they continue working. That is if your employer's health insurance doesn't work for you. But I'd really like to talk with you individually and just see. And you said you're covered until 2027, right?
That is correct. Yes, Phil.
Yeah. So the encouraging thing there for me is this gives us 3 years to figure something out, right?
That is correct. Yes, definitely. I had completely forgotten about that letter until recently when I was playing with the idea that I'm working towards my master's and hopefully I'll be just getting it soon. So I wanted to move on to possibly other areas, if not stay in my current employment. But the more money I make, the more I get penalized, if you already know that. So I'm
Yes.
comfortable where I'm at now, but if I could make more, I want to make more. But once I received this letter, it kind of discouraged me, and I completely forgot about that letter. Like I said.
Yes. Let me do a little homework on Medi-Cal. Okay. I work in Kentucky, and Medicaid programs do vary some, not all that much, from state to state. Let me do a little research on that. Do you see my email at the end of this slide presentation?
I do, Philip. Yes.
I'd love to talk with you afterwards. So let's connect afterwards and let me get some details on your individual circumstance. And we need to find a way to keep you in the workforce and having the benefits that you need and that work best for you. We need to harness the energy and motivation and the expertise you're bringing to this work, and to encourage, not discourage, right?
Absolutely, and that's just my thing. That I'm very proud to be able to contribute to society as a person with a
Yes.
disability, and my disability doesn't make the person that I am. But then, get the insurance part of it. That is my lifeline. So for them to
Absolutely.
say, either you stop working or you cut your hours of work, or we're going to discontinue you altogether. It's a difficult situation, unfortunately.
It is. Well, and you are already contributing to society in all of these ways, and we're glad you are. And let's find ways for you to continue doing that, while at the same time making sure that you're able to take care of your medical and health needs, right? But we got 3 years, but let's not wait 3 years. Let's start this week. Will you email me?
Absolutely, I will do so this evening. Thank you so much for your
Thank
time,
you
and
very much.
I greatly appreciate the presentation. And definitely, I will, like I said, get back to you. I will email you today, and hopefully, we get the ball rolling by tomorrow.
I look forward to talking with you. Thank you. Folks, anything? This is a great question.
Thank you again, Phyllis. I look forward to speaking with you as well.
Thank you.
It looks like that's all, Phil.
Okay, Brandon, anything else?
Not that I am seeing.
Okay. Well, everyone, thank you so much for attending this first of 7 programs that we are going to do. We look forward to seeing you on November 19th. And we want to close by thanking each and every one of you for everything you do and will continue to do to help people with disabilities achieve their goals and realize their dreams. Don't you dare think it doesn't make a difference, folks. It does. Be well, and we look forward to talking, to having you join us again. Thanks, everyone.
Thank you as well. Talk to you soon, Phil. Bye-bye.